Perfect. Okay. So the first thing that I want to discuss with you all is about risk factors. Okay. See, in risk factors, what is risk? First of all, you need to understand risk is the probability that an individual can develop a disease. It's a probability that an individual can develop a disease. Okay. So now in risk, when we study risk, there are multiple things that you need to understand. The number one is risk factor. Then the next term is risk determinant or a background characteristic, also known as a background characteristic. Next is a risk indicator, risk indicator, and next is the last is a risk predictor. Risk predictor, also known as a risk marker. Okay, so you need to understand the terminologies because a lot of time they ask uh, questions regarding this. Okay, so now the first thing, one second please. Okay, the first thing is risk factor. So now, what is the definition of risk factor? It is seen that a lot of time the examiner directly asks an exam about the question about the definition of these factors. So risk factor kya hai? It is environmental, behavioral, or biological factor. These are environmental, biological, behavioral, and biological factors which are when present increases the likelihood of having a disease. It is when present increases the likelihood of having a disease. Okay, so this is a risk factor. Now risk factor के examples क्या क्या हैं? It is tobacco smoking, diabetes, pathogenic bacteria, and microbial tooth deposits. So all these are risk factors to cause periodontal disease. So in risk factors, the examples are tobacco smoking, diabetes, pathogenic bacteria, and microbial tooth disease. Okay. I'm not able to see the chats. Okay. So now the second is risk determinant or background characteristics. In risk determinant or background characteristic, the definition is, so these are risk factors. These are risk factors that cannot be modified. So those risk factors which cannot be modified, they are known as risk determinants or background characteristics. अब इसके एग्जाम्पल क्या हो गए? जेनेटिक फैक्टर्स, एज, gender, socioeconomic status, and stress. Okay, so all these are examples. Now they can ask you a question. ये क्या करेंगे? Example दे देंगे, पूछेंगे genetic factor. What is it? It is a risk factor, risk determinant, it's risk indicator, or a risk marker. So please remember, it is a risk determinant. So you need to remember the example of all these four things. That is risk factor, risk determinant, risk indicator, and risk markers. Now, it means risk determinant are factors that cannot be modified. Similarly, risk indicators. What are risk indicators? Risk indicators basically वो factors होते हैं that are identified in cross-sectional studies, but they are not confirmed through longitudinal studies. So they are identified by cross-sectional studies, but not identified by longitudinal studies. So these are risk indicators. Okay. So what are risk indicators that are identified by cross-sectional studies but are not identified by longitudinal studies? इसके तीन examples आपको याद रखने हैं. Number one is HIV or AIDS, second is osteoporosis, and third is infrequent dental visits. Third is infrequent dental visits. First is HIV and AIDS, second is osteoporosis, and third is infrequent dental visits. Now the fourth is risk predictor and markers. Risk predictor and markers. So these are factors that increase that are associated with increased risk of the disease, but they do not cause the disease themselves. वो खुद disease नहीं करते, but they are associated with increased risk of the disease. So please write down. They are associated with increased risk for disease. They are associated with increased risk for disease, but they do not cause the disease. But they do not cause the disease. And the examples are previous history of periodontal disease, previous history of periodontal disease, and bleeding on probing, and bleeding on probing. Okay, so please remember all these four factors. They are important from exam point of view. Okay. Now I won't. I just want to tell you about periodontal instruments. So what I have done is I have compiled all the periodontal instruments. I have compiled all the periodontal instruments and the surgical instruments at one place. I just would want you all to go through all these pictures. I'll put these pictures into eMedico's app. Just go through these pictures so that you can just recall if some of the questions come from these diagrams. Okay. Also, lasers is very important. Implant we have already covered. Implant is very important. Laser, you can just go through lasers. And there's one chart in Carenza that is given in page number around 600, 604 in the new Carenza in the 11th edition, not the 12th edition. So you can go through the frequencies of the lasers, and there's one chart in which the application of lasers are given. So just go through those lasers, in which one very important point is yeah, I can see your comments. I can see your comments. So that's why I am replying for these. That lasers, that's why one very important point they can ask question is about erbium ERYAG laser. That what happened that when ERYAG or ER chromium YSGG lasers, these lasers, the absorption of these lasers is highest by water. So whatever molecules, whatever tissues that have water into it, these laser are being maximum absorbed by those tissues. Okay, so these ERYAG lasers or ERCR chromium YSGG lasers are the lasers that are absorbed by water. Please remember, and those tissues, either it is a soft tissue or hard tissue, all those biological tissues that contain water molecule, these ERYAG erbium lasers, they absorb, they are being maximum absorbed by those tissues. If you just want to remember the frequency of some of the important lasers, the wavelength of CO2 laser is 10,600. The wavelength of CO2 laser is 10,600. It is 10,600. Okay, in nanometer. All these wavelengths are in nanometer. The wavelength of ERYAG laser is 2940. Erbium YAG laser is 2940. The wavelength of ERYSGG laser is 2790. 90. The wavelength of ER chromium YSGG is 2780. YSGG, erbium chromium YSGG laser is 2780. The wavelength of HOYAG laser is 2100. Then NDYAG laser, very important, lot of time question is asked. NDYAG laser, the wavelength is 1064. Diode laser, very important, the wavelength is 655 to 980. The wavelength is in range of 655 to 980 nanometer. Helium neon 637. Argon 438 to 515. Argon is 438 to 515 nanometer. Alexandrite lasers have a frequency of 337. Excimer, EXCIMER, excimer laser have a wavelength of 193 to 350, 193 to 350 nanometer. For composite curing, argon lasers are preferred. For curing of composites, argon laser is preferred. For हार्ट टिश्यू सर्जरीज, जहां पे आपको केरीज रिमूव करनी है या इनामल या डेंटिन में कुछ मॉडिफिकेशंस करने, देन अर्बियम ग्रुप लेजर्स, अर्बियम ग्रुप में ERYAG, ERYSGG, ERCRYSGG lasers. So erbium group lasers are preferred for caries removal and cavity preparation. For intraoral soft tissue surgery या subgingival curettage, उसके लिए NDYAG laser is preferred. For intraoral surgery and subgingival curettage, NDYAG laser is preferred. डायोड लेजर का है ना काम मोस्टली किस में होता है? फॉर डीपिगमेंटेशन ऑफ द जिंजाइवा, मिलानिन पिगमेंटेशन को हटाने के लिए. सो दीज आर सॉफ्ट टिश्यू लेजर्स. सो ऑल सॉफ्ट टिश्यू प्रोसीजर्स, स्लाइड जिंजाइवल, इवन क्यूरेटाज ऑफ द जिंजाइवा, है ना, बायोस्टिम्युलेशन ऑफ द जिंजाइवा, ये सब किससे कर सकते हैं? डेंटाइनल हाइपर सेंसिटिविटी का ट्रीटमेंट, है ना, ऑल दीज आर डन बाय डायोड लेजर्स. So diode lasers में जो ग्रुप आता है, that is, please write down examples of diode lasers are indium, INGAASP, that is indium and gallium group के जो भी lasers होंगे ना, वो सब diode laser में. So if you get a question in exam, which of the following is not a diode laser, तो जितने भी indium group वाले या gallium group वाले जो lasers होंगे, they all are diode lasers. Okay. सॉलिड स्टेट लेजर्स जो हार्ट टिश्यू लेजर्स होते हैं, वो उसके एग्जांपल्स हैं NDYAG, अर्बियम ग्रुप एंड अलेक्जेंड्राइट. I am not changing the screens. This I am telling you because you asked about lasers. So I am telling you about lasers. Lasers is an important topic you need to cover. So screen is not changing because I have told you about these instruments. These instruments will be posted in the eMedicos app right now. So you can just go through it because there is no point I scroll down each instrument and tell you and waste your time. So just go through those diagrams once. Okay. So I have tried to cover about lasers also. These are some important points. If you even remember these, if the question comes, you can easily answer those questions. Please remember CO2 and NDYAG laser को when you are using intraorally for periodontal treatment, they can ask you what should be taken care of, because they can lead to enamel melting of the enamel. So the contact with the teeth should be avoided. So please remember CO2 and NDYG laser eradication for periodontal treatment. What is the risk? The enamel melting can happen. So this is important, that should be taken care of. Okay. So I guess I don't want you to all waste a lot of time in the other things. We have covered most of the things in perio implants, and I am putting up all these instruments of the list of the instruments, periodontal instruments. Please go through it. Please remember that you have to read your questions properly, give proper time. Don't use the rule out method to answer the questions, and don't make a blunder. Read your questions properly. Don't be in a hurry. You make maximum mistakes in the simple questions. So make sure when the question is simple, you read it properly and then answer. Okay. So all the best. And still, if you have any queries, last minute queries, put it in the group. I'll like to answer. I'll try to answer them as fast as possible. Okay. So thank you so much. And these instrument lists, this PPT would be in the group right away. Thank you.